Edith is a 67-year-old woman who experienced an ischemic right frontal lobe stroke 10 days ago and was admitted to the restorative care floor 3 days following. She experiences left side weakness and difficulties with visuospatial planning. She is currently using a cane for balance. She is having trouble ordering food at the cafeteria. She states that she has difficulty remembering her order and is unable to problem solve when her order is unavailable. But at home, she lives alone in a one-bedroom bungalow. She is a regular church attendee, and members of the church frequently visit her at home and at the hospital. Her son lives an hour away. In her spare time, she enjoys walking in the nearby park and attending church every Sunday. She is satisfied with her ADL performance, compensating using her dominant side. As her primary physician has discussed being discharged within the next week, Edith has expressed concern with her ability to grocery shop when she gets home. She is also worried that she will be unable to make it to church as she has to take the bus. Before Edith is discharged, an occupational therapist has been referred to assess her executive functioning abilities using the multiple Errands test to determine the level of assistance she may need at home and what outpatient services will be needed. Edith and her occupational therapist have identified her two goals to be: Edith will complete a grocery list independently within 1 month, and Edith will independently leave her house and take the correct bus to church and be on time 3 Sundays in a row within 1 month. The Multiple Errands Test Hospital Version, or MET-HV, is an assessment evaluating executive functioning impairments in an everyday environment following an acquired brain injury. The original MET was designed to assess clients with frontal lobe damage who performed within normal limits on tests of executive functioning, but were specifically impaired in everyday contexts. The hospital version was later created for people that fall below normal limits in psychometric measures and are confined to a hospital. It evaluates executive functioning through a series of timed, real-world tasks that the client performs. The MET-DAL is a version of the MET-HV specifically adapted to be performed in the Forrest Building at Dalhousie University. The multiple Errands test is mainly used for assessing stroke and brain injury, although some versions have been used as an executive function assessment in populations with multiple sclerosis, Parkinson's disease, polysubstance use, and schizophrenia. Please note that this assessment is not intended for those confined to a bed or those who have significant motor, language, or cognitive impairments. The MET-DAL consists of 3 sets of tasks, totaling 10 subtasks. Using the score sheet provided, the therapist observes and records errors made, including inefficiencies, rule breaks, interpretation failures, and task failures. In addition, the client completes a pre- and post 10-point Likert scale to rate how efficient they think they will be at the tasks and how familiar they are with the environment before the test, and how well they think they completed the tasks after the test. The therapist needs a score sheet adapted for the site, a stopwatch, notepad, and a pen for observations. The client needs to have a watch, a bag, instructions, and a map of the assessment in the hospital, a pen or pencil, and $6. Okay, so I'm going to explain the tasks that you're going to be doing today. In this exercise, I want you to complete 3 tasks. The tasks are to do the 5 things listed on this sheet, to obtain and write down 5 pieces of information, and to meet me here outside main reception 20 minutes after I have said begin the exercise and tell me the time. However, while completing this exercise, you must obey the rules listed on your instruction sheet. During the exercise, I shall be following you from a distance and observing what you are doing. Please do not speak to me unless this is part of the exercise. So how efficient would you say you would be with tasks such as shopping, finding out information, and meeting people on time? On a scale of 1 to 10, where 10 would be excellent and 1 would be hopeless.
Maybe like a 7.
Okay. And how well would you say you know this area? On a scale of 0 to 3, where 3 is very well and 0 is not at all.
Well, I've been here for a few days now, so maybe a 2.
Okay. Okay, so you're all set to begin the exercise.
Hi Susan, it's Edith calling. I'm supposed to tell you the month and the year. It is February 2017, and it's really sunny today. It's a little chilly, but it's really nice. I remember coming here 2 years ago. It was a really nice place.
As the test is site-specific, there are no normative values to compare scores to. However, the individual sites can develop their own standardized normative cutoffs to compare to based on the rules of the assessment. Often occupational therapists rely on their clinical reasoning skills and discussion with other colleagues to inform their interpretations. Okay, Edith, let's talk about what I observed. So I noticed that there were 8 parts that you had some trouble with. And what that says to me is that you might benefit from further occupational therapy services here to help you get back to your everyday activities. We would not provide discharge recommendations solely based on the results of one assessment. We believe Edith would benefit from outpatient occupational therapist services, allowing her to work on her goals of grocery shopping and taking the bus to church.